Right now, the COVID vaccine is available to anyone 16 and older. But what about kids? How can parents protect them as they re-enter school and get ready for summer break and summer camps? In today's 2-Year Wellbeing, we're talking about kids, COVID-19, new variants, and the vaccine. Medical Director for the Children's Unit at Moses Cone Hospital, Dr. Suresh Nagappan, is joining us now. So first and foremost, let's talk about this. Should we be concerned about our kids who are under the age of 16 and especially all these new variants that are out there?
Yeah, we've heard a lot about the new variants over the past few months, and mutations happen in viruses. So just to lay that on the line, there's nothing new or strange or weird about this particular virus mutating. The cold virus you had last year also mutates too. So that's one thing to know. It does seem like these new variants are more contagious. We've tested the ones from the UK, for instance, is a little bit more contagious. But there's not a lot of evidence that says that these variants are more dangerous in kids or adults. And so that's an important point. And so it's good to be cautious, but I don't think we have to lose sleep at night worrying about the variants compared to the virus that we've already been seeing.
Right, the overall virus. All right, so what do we do though, since we, really can't protect our kids under the age of 16 with the vaccine? That's not possible at this moment. So what is the best way to protect them?
There's a lot you can do, and the number one thing that you can do is if you're over 16, get the vaccine yourself. Because if you form a bubble around your kids, then they're much less likely to get it. So older siblings, uncles, aunts, grandparents, and parents all should get that vaccine as soon as they can.
All right, we've been hearing in other hospitals around the nation that there is an increase in children under the age of 16 with COVID. What are we seeing here?
So here in Greensboro, we saw a big peak around January. So we saw lots of patients come to the emergency room, lots of kids actually getting admitted to the hospital. And it's fallen off since then, but one thing to note is that it's fallen off less for kids than it has for adults. So it's sort of stagnating. The cases are still kind of trickling in, and so it just means that it's not over. And you hear that a lot. I think a lot of people are just kind of hoping and wishing that this is all done, and that's not quite true. I think where it's the fourth quarter, can't take our eyes off the ball yet, but it's not over yet. So still masking, still distancing, and getting the vaccine if you're eligible. Those are the key things.
And so I'm wondering, when you had that peak in January and then the ones that you're seeing trickle in now, are the symptoms more severe in children, less severe? How do we gauge that?
We're seeing about the same severity now as we did a couple months ago, or even at the end of last year. So, and you probably have all heard that in kids compared to adults, the symptoms are not as severe, and that's absolutely true. But the thing to know is that that's not true for everybody, right? So, across the country, there's been about 15,000 kids who've been hospitalized with this, and about 300 kids have died, unfortunately. And so, you put those numbers in context. That that's across the country, and so. It's a rare thing, but it does happen. And so we're always vigilant, right? So we want to be prepared. We want everyone to do everything they can to minimize those risks.
Okay, the kids have been re-entering and going to school. They've been able to maybe do soccer or baseball and stuff like that as the spring has happened. As summer goes through, what are the activities that may be a little riskier to children and families with regards to COVID-19 exposure so that we can, have that top of mind?
Yeah, so I think it's great that kids are getting out and doing things. I think it's been more than a year, and I think that's an important part of growing up is to be able to go outside and play soccer and all those things. But the kinds of things that are going to be riskier are things that are indoors, anything where people are unmasked. And what we saw is there was a surge in Michigan over the past couple months, and a lot of that surge was related to youth sports and outbreaks at youth sports. So there was almost 300 different outbreaks in Michigan related to youth sport. So, outside generally okay, but those inside sports can be a problem, especially if you're unmasked.
Right, because it's not like the tournaments and stuff like that where all of the teams were in a bubble, that kind of stuff. Like these interleague teams are not in a bubble. All right,
it's not the NBA. They can't afford to do that. So they're sort of stuck, and people want to play, and you can't blame them for wanting to play, but at the same time, take every precaution you can to make that as safe as possible.
All right, so speaking of that, let's go to masks and social distancing, because a lot of people were saying, well, now that the vaccines are here, we might be able to get rid of some of that. But what I'm hearing from all the experts, and I'm sure you're going to echo this too, that masks and social distancing still of utmost importance.
You still got to do it, yeah. Especially for kids, because all our kids under 16 can't yet get vaccinated. So masks are still important, especially indoors. And the thing is, now we've got a lot of experience with masks. A year ago, we didn't necessarily know exactly how this would play out. Now, after a year, masks work. I mean, they clearly work. One of the amazing things that's happened over the past year is, every winter we usually get deluged with kids who get admitted to the hospital with different viruses. So not COVID, but other kinds of viruses. And this year, because of masks, that was just a trickle. I mean, we barely had any cases. So masks clearly work stopping germs from spreading. And so it's the thing that you can do that's easy and simple, and they'll help yourself and help everybody else too.
And how do we reinforce these same kind of guidelines? I mean, we've been listening to them and doing them for the last year, right? But all of us are kind of like have a fatigue point, and no doubt kids have a fatigue point. So how do you reinforce that message with kids?
Yeah, I mean, it's good to be understanding. We all are tired of this. Like, everyone wants to go back to normal, especially kids. I mean, this is like throwing the world into chaos in a lot of ways. So, one thing you can do is let the kids be the good guy, right? Like, say, the reason you're wearing this mask is to protect everybody else. And that kind of gives kids that like feeling that they're heroes, they're really helping out, that, even though it's a sacrifice and even though it's a pain sometimes to wear a mask, that there's a point to it, and they're able to help out their community.
All right. So if vaccines eventually become available for children under 16, what advice would you have for the parents that are watching right now?
So the Pfizer actually has done studies now in kids all the way down to 6 months. And they have already submitted their proposal to the FDA for kids 12 to 15. And we may actually see an answer from the FDA as early as next week, or perhaps the week after. So we're right on the verge of this coming out. So what I would say is, what I want to see as a physician, for my patients, is I want to see like all the data. They put out that that press release. They have some of their mainline data, which looks great. But as a physician, as a parent, I really want to see. I'm going to read that line by line. I want to make sure that everything is kind of up to speed and safe. And once we've done that, which really should be pretty soon, and once the FDA has given the green light, I'd say if you're a parent, go ahead and do it. And I'll say, I have 2 kids, and I'll be there on day 1, lined up with my kids, with everybody else, getting the vaccine. And I've always felt like, I can't recommend anything to other kids that I wouldn't have my own kids do. So I wholeheartedly will support it once we see all the data.
Mm-hmm. And one last bit of reinforcement, maybe for those who are 16 and older who haven't gotten the vaccine and can get the vaccine.
Get it right now, as soon as you can. There's it's gotten so much easier to get, and it's really not that hard to do. And if you're over 16, it's going to help you, and it's going to help everybody else. Now, after 4 or 5 months of having the vaccine, we've got millions of people who've gotten this. Lots of study. This vaccine's probably been studied more than almost any other vaccine that we've ever had, and it's super safe. It works great in older people, and it works great in 16 and 17-year-olds too. At Cone, our experience has been pretty amazing. So about 2/3 of people over 75 have been vaccinated, and in January they were like the bulk of the patients that were hospitalized, and now we've seen that go down by 8-fold. So we're just at a fraction of what we used to be for people 75 and over. So to me, that says the vaccine works, and we should all be getting it.
All right, so Dr. Nagappan will be with us until 6 o'clock answering your coronavirus questions. Now, here's how you get one of your questions to our expert today. You text those questions. The number right now on your screen, 336-379-5775. We'll be back.